Welcome back to the Skinfluence podcast. I'm your host, Dr. Dustin Portela. Today we're talking all about chemical peels and peels and reveals.
All right, I'm excited. It's been a minute since I've had a chemical peel, but we do them quite often in the clinic. So.
We do them a lot in the clinic. It is one of the oldest cosmetic procedures.
Yeah.
And one of the things we started with in the clinic before we had any lasers.
Yeah, and it's never a bad option.
No, it's really not. We'll get into, all the science behind them and everything, but they're, chemical peels can be done year round. They can be formulated for basically all skin types, whereas some lasers just are not options for certain skin types. So
Totally.
Let's get into what does a chemical peel do? Ultimately, it's some form of exfoliation.
Yeah, exactly. What I like to tell my patients is if you're going to seal your cement on your driveway or anything like that, you got to pressure, you got to get all the debris off.
Yeah.
And so a lot of times people are doing chemical peels in preparation for something else, or they just feel like they need a refresher. They want a fresh slate. A chemical peel is a great way to get rid of debris, to help clean the top layer of skin, try to open up some of the pores and things like that. So, any other reasons why you use chemical peels?
Well, we use chemical peels in the office when people have significant sun damage. And they're developing what we call actinic keratoses, where the top layers of the skin cells are essentially becoming mutated and cancerous.
Yeah.
And they're very thin. And we often will freeze those with liquid nitrogen. That's not a chemical peel, but it exfoliates that area.
It is exfoliation.
And then we will do, in some people who have extensive sun damage, we will do a full face chemical peel to peel the surface off, all over the face and then just renew the skin. So our skin naturally, renews itself, but as we age, that process slows down. We can get more accumulation of dry skin, dead skin cells.
Right.
And if you're looking dull, you're noticing more texture. Those are all reasons why you might want to exfoliate in one way or the other.
Chemical peels definitely will brighten the skin, help remove some of that superficial pigmentation, things like that. Now, there's different types of chemical peels. There's peels, there's chemical peels, and then there's physical peels, or physical exfoliants. Chemical peels are things like AHAs, BHAs, glycolic, salicylic acids, and then there's the really strong one, the phenols and things like that. And then there are physical type of exfoliants, things where you scrub or brush the skin. I typically don't recommend physical exfoliants very often because it is harsh on the skin. It can tear the skin, things like that. But chemical peels usually done in the office in a safe, clean, sterile environment, and you get a little bit better results with less damage to the skin. Although there are things that you can get over the counter that can help as a physical exfoliant, but I typically will recommend to my patients the chemical type exfoliants.
I think everybody's first experience with physical exfoliation was the St. Ives apricot scrub.
Oh yeah, this is St. Ives.
Little shards of walnut shells in there.
Just tearing your skin.
And we just didn't know better. We're rubbing that stuff all over. You feel it and you just get that impression it's doing something.
It's doing something to me.
And what it's doing is it's causing little micro tears all over your face and compromising your skin barrier.
Everybody used it too.
Everybody. Their marketing must have been on point and there was just no other options.
No, yeah.
Nowadays there's, so many different options out there. But you can also, there's, scrubs with microbeads in there. Nowadays they all should be biodegradable microbeads rather than microplastics. There's dermabrasion that we do in the office. Dermabrasion uses like a diamond tip on there and we go over the skin. And there's, dermabrasion we still use sometimes for scar revision. We do it differently in the clinic. Some people would be surprised. Like if I'm going to dermabrate a scar on somebody's nose, we'll just go to Lowe's and buy drywall screen. And then sterilize it. Oh, for real. And then
kidding.
Yeah. And then you can take that drywall screen that's been sterilized and you just wrap it around a 3cc syringe and you can dermabrate a nose. So that's not microdermabrasion, that's dermabrasion. Because we're really getting in there, but we're taking off top layers of scars. Definitely don't do that at home.
Yeah, I was going to say, I think some DIYers are going to be like, I got that.
I got drywall screen in the shed.
I wouldn't recommend doing that at home for sure, but...
So most people at home are going to be doing some form of chemical exfoliation. You mentioned AHAs, that's alpha hydroxy acids. That's going to be your glycolic acid, lactic acid, polyhydroxy acids. And then BHAs is salicylic acid is the main one that people are going to be using.
Yeah.
Penetrates through oil on the skin a little bit better. If you have acne, that's something that's going to maybe do a little bit better job getting down into the pores.
Yep.
When we have people in the clinic and we're doing chemical peels for acne, we often will use a combination of mandelic acid and salicylic acid. So we get AHAs and BHAs there to help remove some of that excess oil and resurface the skin. And we're going to be going much higher over the counter. You can buy 2% salicylic acid.
Yeah.
And we'll go up to 20%, 30% here in the clinic, depending on the needs of the patient. So we have the ability to get a lot more, downtime if we need to, but in a safe and controlled environment, like you said, where we're prepping the skin, we're managing the penetration and all of the with the number of passes that we do.
Yeah. Most cleansers over the counter that are more aggressive, that aren't hydrating, are the BHA, the salicylic type acid,
Right.
but the 2%, like you were saying, can you get it? I don't know, maybe 10%. I think I want to say I've seen 10%, but that
You
may be a
can
little too
probably
high.
find it if you are looking on Amazon. I don't recommend it.
Yeah.
The FDA for consumer products kind of limits it at 2%.
Yeah.
And that's kind of where you should stop. And I have seen people that left the 2% on for a long time and literally had a chemical burn in the middle of her forehead.
I
This is a
believe it.
patient that is on residency. It took months for that discoloration to fade.
That's sad.
And supposedly it was just a 2%. So you do have to be careful. Just because you can buy it at Walgreens, Walmart, CVS does not mean you can't still damage your skin with it.
Yeah, you want to leave it on just for a short amount of time, let it do its thing, and then wash it up. But yeah, if you leave it on for a long time, it's just going to continue to work.
Yeah.
So
A lot of products have glycolic acid in them, polyhydroxy acids. Neutrogena had a whole line of cleansers. They still do. PHA cleansers, which are very gentle. It's a large molecule size, so it
Right.
doesn't penetrate deeply to go and really disrupt your skin barrier. Very hard to hurt yourself with PHAs.
yeah. What are some things to be cautious about when you're looking into chemical peels?
What I recommend is that patients start slow, and that means you're going to be using something probably on the lower end. Even if you can get something higher over the counter, start
Yeah.
with lower, a 5% glycolic acid, and you're going to rub that on 1 or 2 times a week. On those nights, you're going to skip your retinol. You're going to skip other exfoliating types of treatments.
No actives.
No actives. So you want to just kind of start slow and watch for results to develop. If your skin is doing great on that and you want to go up to higher percentages, you certainly can. But it's just something that you don't have to be in a hurry about. Take your time, wait for results to come.
Yeah, and you can do them in a series, so it's not like it's going to be months out before you do your next one. But that's what I recommend to my patients who are coming in. And they are wanting some sort of cosmetic treatment, but they're kind of trepidatious about doing anything too intense. And I'll usually recommend if they're looking for, like, if they have hyperpigmentation of the face or melasma, things like that, acne scars, I'll recommend a series of chemical peels where you start really mild and then you can work up as they tolerate it, and depending on the results.
When you have different skin types, you have to be cautious about the types of peels that you're using.
Totally.
If you are a darker skin type, you have to probably be a little bit more careful for post-inflammatory hyperpigmentation. Another good reason to start low and go slow. And then the other group of people that I think should be really cautious with peels are those who are just incredibly sensitive, like our rosacea patients.
Totally.
People who flush easily.
The perioral dermatitis type patients.
So just because it looks like acne doesn't mean that it is, doesn't mean that it's going to respond well to chemical peels.
Yeah.
Rosacea, perioral dermatitis, there's so much barrier dysfunction there. Peels are going to exacerbate that and probably make it worse.
Which is another reason why going to a clinical dermatology practice to get advice is a good idea if you're thinking about doing chemical peels. Because if you have underlying conditions or you have sensitive skin, we can kind of talk you through what we think is going to be beneficial for you. Or say maybe you're going to want to avoid that for now until we get things under control. But using dermatology professionals to guide you in the decision of what kind of chemical peels and things like that is a tool you can utilize.
Yeah, it doesn't mean that you have to do the procedures in office. We can recommend types of products either that we sell or that you can find over the counter.
Totally.
Before we continue on with best practices for in-office peels, let's have a little Did You Know?
Let's do it. All right, so I have an interesting Did You Know about ancient chemical peel practices.
Let's hear it.
Apparently, Cleopatra bathed in sour milk to help renew her skin.
Interesting.
Yeah. So apparently, sour milk has lactic acid in it.
Yeah, that would make sense.
And so she would sit in it I don't know how long she's able to sit because probably didn't smell good.
I feel like all milk would be sour in that era. They didn't have refrigeration,
Right?
Unless that's what those things are
right
underneath
out the cow.
Pyramids now.
The pillars under the
pillars
pyramid
were just big refrigerators.
They're just they stored all the milk that Cleopatra bathed in.
That she bathed in. Yeah. She like set every beauty standard that we follow today. Like one of the first ones to use makeup.
Totally.
And I feel like it's like a Wayne's World. Like she must have been a babe.
She probably was.
Probably.
She probably
did
had some
all the
awesome
things.
tattoos. And,
Yeah. Yeah.
and her skin was pristine because of the sour milk baths.
Yeah. Well, if you're not using chemical peels or other forms of exfoliation, under normal circumstances, your skin is renewing itself about every 28 days.
Yeah.
When these cells start at the basal layer and then they move up and ultimately should be shedding off. That process takes about 28 days. As we get older, though, that process can take longer.
Sure.
And we see our elderly patients a lot of times with very dry skin and flakes because they're not exfoliating. The skin's not doing it as well naturally, and that's where using a moisturizer that exfoliates a little bit can be helpful. Something that has a little glycolic acid in it, maybe a retinol or even a urea cream.
Yeah.
So
interesting. So we don't need chemical peels. We're just exfoliating ourselves.
We really are just exfoliating ourselves all the time. So we see that the worst example is, and for our patients that listen to this, we love you. However, when I have a patient sitting there for a skin exam and they left their socks on, and I'll ask, do you want me to look at your feet? I would advise you to cautiously take off your socks, like slip them down with your fingers from the top. But the people that grab the toes and just yank it, and then like all this dead skin cells and debris goes fly, and it's like a cloud, and I'm like holding my breath.
How many times have I been sitting there and they go, "Oh, I have something I need to show you," and they flick it off, and you just get a puff of dead skin in your face. You're like, you gotta warn me. You gotta warn me.
Yeah.
Yeah.
We still love you, but we would like to give you more instruction on how to take off your socks.
I have a feeling now, if anybody's listening, they're going to do it on purpose to you.
Probably. And we deserve it. All right. Well, we've talked about home chemical peels. Okay. Let's transition into the in-office chemical peels. These are going to be some of the same ingredients that people use over the counter, but we are bumping up the strength.
Yeah. These ones usually are going to be penetrating a little bit deeper. A lot of times we'll be there with a neutralizing agent in case it gets too spicy. But what conditions do you typically treat with chemical peels that are more powerful, that have more effects, and what does the downtime look like?
The most common chemical peel that I do is going to be a 35% TCA chemical peel, trichloroacetic acid. Now, acetic acid is vinegar, right?
Yep.
You can use that over the counter, and it is slightly acidic. So TCA, trichloroacetic acid, is a modified form, and it's significantly stronger.
Yeah.
If you've ever had a biopsy in our clinic, we're using a little bit of TCA to stop the bleeding on there.
Yep.
Because it does stop bleeding very effectively. But when this goes onto the skin, it can start to form something called a frost. And that is, as it's going down, the skin cells are desiccating, they're dying, and you're going to turn white. When I have done a TCA chemical peel over the full face, I know that I'm done when the whole face is like sheet white. And that's going to last for a few hours, and then they're going to turn red as that inflammation starts to increase. And then over the next several days, the skin will start to turn brown as it flakes and peels off. And that process takes about a week on average. I am most commonly doing this for individuals who have a lot of precancers on the skin or significant sun damage. Maybe we've done several skin cancer surgeries on them. I've treated, 10 to 15 precancerous lesions with liquid nitrogen every time they come in. And we're looking for something that's going to be a little bit more preventative for the whole area, rather than, as I describe it, just playing whack-a-mole with my liquid nitrogen gun, where we're just hitting things we see. We want to get the things we see and the things we don't see yet.
Right. Now, I have had a TCA peel done once, and I was a big baby, and I was constantly being like, no, neutralize it, like get it off. And it's probably not as painful as I'm making it out because I'm a big baby. But
do you know what strength you did?
It was like 6 years ago. I don't remember exactly.
Yeah.
But I was frosty. And but my skin, after it healed, so it went through the frost phase, it went through the the sunburn feeling phase, and then it peeled, my skin looked and felt great for quite a while afterwards.
Yeah.
I was really pleased with the results, but there is some downtime. And so one of the things that you really need to be careful of is the aftercare. You go over it, Morgan goes over it, we go over this a lot, but protect yourself from you can't go out in the sun for at least that first week, and then very diligently putting on sunscreen afterwards, and then healing ointments, because the risk, like you had mentioned earlier, of the post-inflammatory hyperpigmentation, using some sort of healing balm like the Dr. Rogers healing ointment or something along those lines to help keep that skin barrier, or help the skin barrier repair.
Yeah. Yeah, so 35% TCA is the most common chemical peel that I do. Our esthetician, Morgan, is doing a lot of Perfect Derma peel. So this one has several different ingredients in it. It does have a little bit of phenol in there too.
Ooh, the strong stuff.
Very low concentration. And at those low concentrations, it acts almost as an anesthetic. So it's a very comfortable peel, but also can give you up to a week of peeling. So it can still be, very effective. The Perfect Derma Peel also has glutathione in it, so it's really good for those with hyperpigmentation. It's been shown to be safe for lots of different skin types.
Interesting.
For our acne patients, we use something called a GTZ peel, which is a glycolic acid, a small percentage of trichloroacetic acid, and zinc for some anti-inflammatory benefits. We also use mandelic acid and 20 or 30% salicylic acid for our acne patients. And the downtime on those is really only 2-3 days in most cases. Even though you think 20 or 30% salicylic acid would be really, really high, but you have to know, how long you're leaving this stuff on, if we're going to neutralize it, if we're not going to neutralize it. Things like glycolic acid at higher concentration should be neutralized, whereas TCA is self-neutralizing. That means we don't have to wash it off. We can leave it on the skin.
Yeah.
A lot of times we'll spritz them with water anyway to help them cool down because it's real hot.
Yeah.
Real spicy. If you're doing a TCA peel with us, we often will put on topical numbing medication on the face for about 30 to 45 minutes before, just to help, mitigate some of that discomfort.
Yeah, because it can be pretty uncomfortable. Yeah, the GTC pills, they do a great job. My patients tolerate them very well, very happy. They help just kind of, especially when they're on the edge, they're on some sort of acne treatment and they just have a little bit of a breakout or a little bit of acne left over. The GTC pill can help get them over the edge.
Yeah. Then we should touch on the phenol peel.
Yeah. I have you had the phenol peel done before?
I've never done it on myself.
Yeah. I'm too scared.
I've used a little bit of phenol on like acne scars, but very pinpoint.
Okay.
But the cases where I've showcased them on social media where they're showing these full face phenol peels, this is probably the best thing to remove wrinkles from the face. I think it beats a CO2 laser.
It probably does.
When it is done correctly. However, the phenol peels have significant risk associated with them.
Yeah.
So phenol is a known cardiac toxin. And so when you put it on the skin, you have to be very mindful about the area that you are treating. And if you're just treating like the area around the mouth, you're not going to absorb enough to put any risk of your heart going into an arrhythmia. But if you're doing a full face,
you gotta burp.
Some people may absorb enough that they could potentially get a little arrhythmia. And so we need to hook these patients up to cardiac monitoring. And that's why it should be done only with those who are incredibly experienced, trained really well. And the truth is, this is not something that I have been trained on, so I don't do it.
Yeah, I'm the same way. I've seen them done. I've never done them. I've never worked at a practice that did them. But it's kind of a wild procedure for a facial, but great results with it.
The healing can be several months on these.
Yeah.
So the peeling is much more extensive. It goes so deep into the dermis. And then once the new skin is there, you're still going to be red sometimes for 2-3 months. So usually when you're seeing a before and after on social media, it might be 6 months later before you're really seeing that person. So you are committing to this as like, I'm going to take off 20 years and I'm willing to give up 6 months in order to do that.
Yeah.
So it's something that you're very cautious about when you're performing these procedures. And every time that I post a reaction to one of these phenol peels, I will get dozens and dozens of messages wanting to schedule to do it.
Oh,
and
really?
People don't understand that I'm not the one performing that.
Yeah.
Even though a lot of times they're in South America, they're speaking Spanish in the video, and I'm clearly not speaking Spanish.
Yeah, that's interesting. So they're pretty popular then, I would imagine.
Yeah, they are pretty popular. It's one of those things also darker skin types have to be very careful with because you can risk some pigmentary alterations. Yeah. And if they're not done properly, you can scar the person doing these kinds of peels.
Well, you're going down into the dermis, for sure.
So there's a few myths around chemical peels we probably should address. And one of those is, that higher percentages are always better.
Yeah. Higher percentages aren't always better, especially depending on the skin type. But like we discussed earlier, I always say start low and work your way up. But where does the myth come from where more is better?
I think that's just the myth with everything. Right? Yeah, more is better. True. If a little is good, a lot must be better. Yeah. The medicines that we take, the vitamins that we take, the procedures that we do on ourselves, that you always need to go bigger and better. And maybe it's a uniquely American thing. I don't know. But it's not always the case. You have to think about, your social life, school, work, whatever it is that you're doing. Going to higher percentages and giving yourself downtime once or twice a month is not ideal. No. And you can get excellent results with a very mild chemical peel, very mild chemical exfoliation, at more regular intervals. Yeah.
And that's, I guess that's true. There's a lot of go big or go home type. But taking things methodically and doing things in a smart way is always the best option. I don't know of any other myths associated with chemical peels besides more is better, and then or darker skin types aren't a candidate for chemical peels, which isn't necessarily the case.
No, not necessarily.
Depending on the type of peel and the strength of the peel, darker skin tones can definitely do chemical peels and yield and have great results from them. You just have to be careful about.
Yeah, it's one of the reasons we have the Perfect Derma Peel here, because it's safe for a wide range of skin types.
What are some good alternatives to peels if you feel like you're just not a candidate, you don't want to go through the chemical peel process? What are some other options you give your patients?
Everything every day you can do at home is going to be like a retinol. Retinol does do some exfoliation. It helps to bring off the top layer of dead skin cells very naturally. And if you can use a retinol consistently, you're going to see more even texture to your skin, reduced appearance of the pores, less likelihood of developing acne. So just using a retinol is a really good option. We talked in an earlier episode about microneedling. Yep. Microneedling is a good way to help rejuvenate the skin for lines and wrinkles as well. And then there's laser resurfacing procedures, things like CO2 or erbium laser. And these can be fractionated where you're just making small holes in the skin, or they can be fully ablative, like a chemical peel where we're applying it over the whole face, removing the top layer of skin, and we can control the depth very well on that. It's important to know that most of the time, though, chemical peels are going to be less expensive than laser treatments. Yeah. They have been around for a long time, and without getting into specifics, I can tell you my overhead cost as a practice owner, it costs me a lot less to get the material for a chemical peel than it does to purchase a laser and to use that on a patient.
I believe it.
And so chemical peels, you can do a whole series of those where you're getting 3 to 5 chemical peels for the same cost as CO2 laser resurfacing on the face. Yeah. So we pass that savings along to the customers that we serve.
Right. And with less downtime and still getting results that they would like to see out of their skin.
So that's everything you need to know that we can think of on peels and reveals, both physical and chemical exfoliation. It's a practice that I incorporate, into my routine every year. I'm doing some type of resurfacing procedure. I do some of the GTZ peels regularly. I'll do a laser treatment once a year on myself. And then I'm always experimenting with at-home chemical peels. Yep. Most recently, I used the dual action peel from Philosophy Skincare. Oh, it had a little physical scrub and then a chemical exfoliator on it. It felt great. I did a YouTube video on it. We can link to it on the video portion of this. And a couple of products that we have to recommend. The first one is the Dean Skincare Rapid Reveal Exfoliation Pads. These are a 15% glycolic acid. You get 60 pads in a jar. So 15% is safe to do at home. Yep. You can put this on. Don't use your retinol that night, but you'll wipe that on the skin, leave it on for a few minutes, rinse with water, and then moisturize.
Yeah. I have those, and I've used them, and I like them.
Yeah, they're very good. The other thing that we'll include as a product feature is the Alpha Ret Peel Pads from Skin Better Science. Beautiful. So these are a retinol-style chemical peel that you can do at home. They come in a little towelette that you can wipe on the face, give you a little boost above and beyond what the Alpha Ret is doing for you. Yeah. And again, skip your retinol that night that you're doing it. So a couple of really good options if you want to do some more exfoliation at home.
Awesome.
That's it for this episode of the Skinfluence podcast. I'm Dr. Dustin Portela. You can find me on all social media channels at Dr. Dustin Portela.
And I'm Austin Lee. You can find me on TikTok, Instagram, and YouTube at Austin Lee PAC.
If you guys have enjoyed this and are enjoying our episodes, please share them with a friend and leave us a 5-star review wherever you listen to podcasts.